Has recorded its first measles case this year as Texas deals with an outbreak. Thanks for joining us. I'm Rob Williams. Tricia is off tonight. Our Brady Williams spoke with health experts who say Ohio residents might be at a greater risk to get the measles. He joins us live to tell us why.
Yeah, so measles, up until a few years ago, you could not contract it in the United States. You had to go out of country and bring it back with you. That's no longer the case. It's no longer considered eradicated. And local health experts tell me that that is likely because of vaccination rates.
It spreads very readily and really rapidly unless you have a high baseline immunization rate.
Cincinnati Health Commissioner Grant Mussman says you need a population vaccination rate of around 95% to keep measles out of the community.
Ohio's kindergarten immunization rate is about 88%.
In Texas, an outbreak has been linked to over 300 cases, while Ohio recorded its first case on Thursday. Dr. Mussman says Ohio has a lower vaccination rate for measles than Texas does. Pediatrician Dr. Robert Frank with Cincinnati Children's Hospital explained that measles infections can usually be minor, but not always.
Measles itself can kill kids, and it does kill kids, and we don't want to see that happen again.
2 deaths have been linked to measles so far this year, and they're the first ones in over a decade. Dr. Frank says measles often begins with flu-like symptoms, but you'll soon develop a distinct rash. He says you can develop pneumonia, and in severe cases, measles can lead to lifelong blindness, deafness, or brain damage.
We can't predict who or which child is going to be the one that's going to get the serious infection. And that's why we recommend everyone get vaccinated, because now we know everyone is protected.
Dr. Mussman says measles is contagious enough that you can be exposed just by being in a room up to 2 hours after someone with measles was in that room. Measles patients in Ohio need to be quarantined for 21 days, so make sure you communicate with your doctor.
You don't want to just show up at an emergency room or at a healthcare facilities without calling ahead.
So if you're concerned about it, they say make sure you have your vaccination. It should be the MMR vaccine, and you should have had 2 doses if you've got it. They say make sure to check your vaccination status, and if you have any questions, as always, check in with your doctor. Live in Cincinnati with photojournalist Philip Krinsky, Brady Williams, Fox 19 Now.